Hi, my name is Ismail Shaikh, and this is my final presentation for PHIL351. My topic is Had advancements in medical technologies brought more ethical issues than benefits? There have been many technology advancements in the medical field. Good examples of this is in the invention of the blood pressure monitor in 1881, to the first heart-lung bypass machine in 1953, to modern day where we really have AI and robotics that lead to data-driven decisions. I think a good example of this is the famous video of robotics doing surgery on a grape. That video has been circulating and showing how precise robotics can be used to make precise precisions. My thesis is these advancements provide major benefits that will continue to improve society, but they also introduce ethical concerns like privacy, bias, and the role of human judgment in medicine that need to be addressed. The first advancement I'd like to talk about is genetic engineering, specifically the pro side. The pros of genetic engineering is to remove harmful genes, improve long-term health, and really modify a person's DNA to remove genetic disorders from their bloodline so it will not be passed on to the next generation. A good example of this is at the Children's Hospital of Philadelphia, where they did genetic engineering on KJ, an infant born with CPS1 deficiency. Because of this procedure, KJ was able to recover from his disease and no longer face the possibility of facing hyperammonia, which could lead to neurological issues, seizures, coma, and disabilities. Because of this procedure, KJ was able to potentially have a longer quality of life and a better quality of life. Then there come the cons of genetic engineering. The cons are really unpredictable outcomes, high costs, and only available to the wealthy. Good examples of this is a genetic engineering research that was done in China where two twin babies were genetically modified to be HIV immune. Initially, it was proved to be beneficial where they became HIV immune, but there were a lot of risks and unexpected consequence of messing with the CCR5 genes. This actually caused the twins to carry higher risk of infection from West Nile virus and the severe flu. And this happened because we underestimated the actual consequences of genetically modifying a person and not seeing what could potentially happen to the person. Then there comes the high cost and only available to the wealthy. So currently the world's first approved CRISPR-based cell therapy has been priced at $2.2 million per patient. That high cost is quite expensive where it really isolates who can use genetic engineering and who can't. Clearly, $2.2 million is quite a lot, where only the wealthy can be able to afford this, while a person who is living paycheck to paycheck would not be able to afford the same treatments. The second advancement I'd like to talk about is predictive AI, specifically the pro side. So the pros of predictive AI is data to predict diseases. You're able to feed a patient's history, family history, and current symptoms to be able to predict what is actually occurring. Doing this will allow for early diagnosis and be able to catch diseases early on before they grow and really cause more damage. This is done by data driven decision making, having all that information present. Also, predictive AI allows for a personalized treatment plan. Based on a patient's history, you're able to see what type of medicine they can take or what type of medicine work for them specifically for their body. Doing this would allow for efficiency. Then there comes the cons of predictive AI. So one of the cons is data privacy risks. With all this information really being fed to AI, we don't know how it's being stored, what type of data is being provided, what will happen to this data, and can we ensure that patient data will remain at the hospital and not be found anywhere or any data breaches happening? Because this type of information is very important and really needs to be protected. Then there comes the bias in decision making. AI is fed on data that could potentially have a bias towards a certain minority group. So, to make the best outcome, AI needs to be mitigated in its bias. Then there comes to be the accountability for decisions. When an AI makes a decision for a person medical treatment, who will be held responsible if there is an error or is there an issue? Would it be would it be the AI? Because how is that possible? A bunch of these questions come up with, how do we know the AI is accurate, and what is the guarantee? Then we have remote patient monitoring. The pros of remote patient monitoring is we're able to track a patient's health in real time. We so the way remote patient monitoring works is you connect medical devices like blood pressure machines uh, to a person at home, and all that information is sent to the doctor at their labs. You're able to reduce frequent doctor visits and really enable continuous care. The cons of this is having constant medical equipment on you and really checking information can cause constant anxiety, always being worried of what if something's wrong, and really being able to have constant anxiety about this. Having this much constant anxiety can actually cause more harm than the good it was initially trying to do. Then there comes for difficult for elders to use. Remote patient monitoring is primarily within the elderly, but they aren't really as technology efficient as the younger generation. So the real question is, how would it be properly used by the elderly? Then data may be inaccurate. How are we confident that the data machines that are provided to the patients work properly and the correct information is being sent over, rather than wrong information that could lead to anxiety or inaccurate diagnosis? Then, similarly to predictive AI, there comes the privacy data security issues about how our information is being used, who has access to this information, what type of information they're used, and what is the guarantee that this information will not be leaked. So my analysis is that genetic engineering has the potential of a lot of good that can be done, specifically stopping with genetic disorders. But there's a lot of cons about this. The cons really weigh heavily here, showing how unpredictable genetic modifying is, where we really don't see what the possible consequences are. Then there comes the fact about the price. Not many people can afford this, and people who can afford it are wealthy. So this really creates a disparity between who is able to genetically modify versus non-modify. Should a person really be able to stop a genetic disorder just because of money, just because of the class, like the wealth class they were born in? Then there comes predictive AI. Predictive AI is very important with how producing results and specifically predicting early diagnosis. It's clear that there are a lot of ethical concerns around data accuracy and really accountability. And I believe the best way to handle this is by hospitals and doctors really being transparent about what type of information is being fed, how the data is being stored, and really having oversight in the AI, not allowing AI to fully make the decision, but having a doctor's oversight to review the information and to guarantee that the data provided and the outcome provided is accurate. This can allow there to be accountability with predictive AI. Then comes remote patient monitoring. Similarly to how predictive AI is, I think there needs to be a transparency of what type of information is being sent over and how that information is being used. I also believe that there needs to be more testing with devices to ensure that everything being provided is up to date and has no deficiencies or issues with the machinery. Then there comes the fact of elderly care. I believe there needs to be a way to teach the elderly how to properly use the device, or make the devices as simple and easy to use, where it really allows people with technology deficiencies to be able to use it without knowing much. My conclusion is that technology improves healthcare. It's clear over time that technology is important and has continuously improved saving lives. The potential benefits outweigh the ethical concerns. That is a guarantee. All of these technologies have the potential to cause great benefit, but the ethical issues must be addressed. And the way we need to handle this is addressing the ethical concerns as they come up. For example, a lot of these things, like predictive AI, have no regulation. It's because AI is so upcoming and has been advancing at a rapid rate where we cannot hold on or have laws defending or like having limits around AI. That's why I believe as these ethical issues come up, they must be addressed at the same speed that technology is being improved at. Thank you for your time, and I hope you have a great day.